I remember if I said this way.
Yeah.
Hello, this is Brianna Pat with the Dallas Weekly, and I'm here with Paige Jackson from the Abide Women's Health Services in South Dallas, and we are going to talk about everything that they do for women in the area, their midwife services, prenatal, postnatal care. We're going to get all into it. But first, thank you for allowing me to interview with you. Thank you for taking the time out of your day to do this, and I guess we'll get right into it. So my first question is, how did Abide Women's Health Services start? What's the story from, I guess, a more anecdotal standpoint, maybe things that people just generally wouldn't know from the outside looking in?
So Abide started with a dream, right? Cecily is our visionary, Cecily Smith, and she had the dream to have a birth center in the hood. We know that with the disparities that Black and brown women face surrounding childbirth, that those disparities far outweigh our white counterparts. And so Cecily had the dream to have a safe place in the hood for families to be able to come and receive services. And so she initially started off her career as a doula and childbirth educator, serving families. And she kind of had this awakening when she met Jenny Joseph, who is a British-trained Black midwife who's been in the States for about 40 years, and she came into Texas to be a keynote at a conference and shared about the disparities in maternal mortality that Black women face, Black and brown women face, and it kind of jolted Cecily into purpose.
And diving even further into that, what played a role in your personal decision to join Abide? I know, at least from the research I've done, you worked as a CNA and you're currently studying to work in midwifery. So were those things, or more, is there a more personal story behind it?
Yeah, absolutely. So for me, I grew up hearing about childbirth, right? My great-great-grandmother was a midwife in the Little Rock area and caught countless babies, including my grandmother, who was a triplet, and who lived for, until old age. So home birth has been this process and this world that I've always known about my entire life. And so I decided to pursue midwifery based on just the knowledge of knowing that women deserved options. And even working in the hospital, knowing that shouldn't be the only option that women face surrounding childbirth, or that they're offered. But also personally, because I, myself and my daughter became a statistic. And so my daughter's birthday is actually today. 12 years ago, I had a daughter, and she was birthed prematurely and passed away. And so that kind of helped to jolt me into purpose as well, to help provide those services and that comfort measures that I didn't have during that time.
And my next question, from what you've seen, what has been the impact of the clinic services for the women of South Dallas, i.e., just like maybe a change in their attitude, maybe feedback from patients and people who have visited, in whatever regards to their care, whether it was just prenatal, whether it was postnatal and midwifery. Midwifery, I think I said that right?
Yeah. Both ways.
Yeah.
But so it's similar to kind of just walking through the doors, right? That's kind of the first experience. Walk through the doors and just realizing that this clinic exists in an area where it may not be as built up, right, as other neighborhoods in the city. And so a lot of our clients just feel at home and they feel welcome when they come in here. And so it's just been a relief to be able to find a place. We offer our services free or low cost, right, or donation based. And so to come and find a provider where you have people who look like you, because our staff is predominantly Black and brown. So to come in and receive care, loving care, non-judgmental care from providers who look like you has been a game changer for a lot of our clients, and has helped to reduce the stress that they feel surrounding childbirth, right? Because childbirth itself is stressful. And so we've heard a lot of feedback in that regard of just having a safe place to be able to come and receive services, but also even if they just need to come and be, right? It's a safe place away from the world. This pocket we've kind of created here in this clinic. So, yeah.
And my next question, how from your experience and from your personal observation have women been impacted by those negative pregnancy experiences? Either, obviously a lot of women go through miscarriages, either stress-based or for medical reasons, who may walk into here and say, hey, I'm going through another pregnancy and I'm looking for different care? How's that impacted? How have you seen the impacts of that on them?
Yeah, in changing those outcomes, those negative outcomes. With our services, we were looking at our statistics from last year. We have not lost a mom. Maternal mortality rates are 4 to 5. Black women are 4 to 5 times more likely to pass away surrounding childbirth compared to our white counterparts. Black children are 2 to 3 times less likely to survive to their first birthday. And so with our families, we haven't seen those disparities. We lost one newborn last year, and that was due to a heart defect that wasn't caught during labor. The mom delivered at the hospital, and so they discharged her home, and that baby ultimately passed away. But we haven't seen the disparities on the level that it is in Dallas County and the nation as a whole, because our care that we provide is so culturally competent, but it's also non-judgmental. And we also provide complementary services that wrap around the families and help to support them in ways that decrease stress. And so all of those things play a part in changing those negative outcomes.
And can you go into more detail about Abide's approach to pre- and postnatal care and how that may differ from the way other clinics or hospitals are ran?
Absolutely. And so our clinic, we kind of run on the JJ Way model. And so JJ Way was created by Jenny Joseph, who I mentioned earlier. And with that model, we support women. It's traditionally built on the midwifery model of care, where women come in and they see a provider and they're able to ask all the questions, and they sit for an hour, and they're just able to see the same provider. But with the JJ Way, it makes every person on the team a part of that client's care. With the midwifery model, it's generally the midwife is the center of that care. With our model, the JJ Way model, every person who works at Abide is a part of that care. And so that allows for the clients to be able to connect with whoever they need to connect with, but be able to receive all of the services and the encouragement and the support that they need across the team. And so not only is that beneficial for the clients, but it's beneficial for us as a provider, as staff of Abide, so that it's not so heavy on us, because this work is heavy.
And was lactation support an original aspect of the Abide Women's Health Services, or was that something that was added later? And if it was added later, what was the inspiration or backing behind that? Was it more a woman came in and you guys thought, oh my goodness, this is something we never even really considered, or just kind of going more into that story? So the first 2 programs, or really the first 3 programs that we started at Abide before the clinic even became, the clinic was still a thought at that time. Back when it was just Cecily and our other support team or other support members. We had Baby Cafe, a partnership with Mother Milk Bank of North Texas, where we provided a breastfeeding support group called Baby Cafe. So it's essentially a place where people who are breastfeeding, who are interested in breastfeeding, who may be pregnant and just want to be in an environment where women are breastfeeding, because it helps to increase the rate of breastfeeding. That was always a thing. And so Baby Cafe has always been a part of the thread of Abide, in addition to our childbirth education classes as well, and the material goods program. And so all of those things have always been a part. And breastfeeding there's so many benefits, from breastfeeding. So it has always been a part of the thread of Abide. And my next question, can you go into more detail about the clinic's values and your commitment to making sure that anti-racism crosses over into the care in every way?
Yeah, absolutely. And so here at Abide, we pride ourselves not only on educating about anti-racism and doing the work to check our biases, right? So implicit bias training. Every staff member, every volunteer goes through the same training process. And it's not just for the benefit of our clients, but it's for the benefit of ourselves and our families and the community as a whole. And so that's something that we pride ourselves on. And we're also very non-judgmental. So someone can walk into the clinic and have questions about an abortion. We don't provide those services. We don't refer out for those services, but we will sit and listen and help someone to kind of navigate what that will look like, and support them in their decision, right? So it's non-judgmental care. It's meeting people where they are and not judging them for not being where we think they should be.
And what does Abide have? Oh, sorry. How did COVID impact the availability of services for Abide?
Yeah. So we opened in the middle of a pandemic. We opened our clinic in the middle of a pandemic. I moved here in the middle of a pandemic. And until recent, we were kind of going, still safely, of course, like every other location. So when clients would come in, they would do the COVID screening. Everybody had to wear a mask, temperature checks at the door, things like that. And it wasn't until this new variant happened that this more contagious variant kind of came about that we had to start running on a skeleton crew with our staff. And so currently we've reduced the hours of the clinic. So where we were typically open on Tuesdays and Thursdays from 10 a.m. to 6 p.m., we're now open from 10 a.m. to 2 p.m. With the administrative assistant or the front desk person and the provider, the only two people in clinic. All the other services are being provided virtually to clients. So education they may need, referrals for support services, all of that has happened virtually for the time being. Yeah.
And going into my potentially final question, because I, at least from what I'm seeing, I think you have answered almost all of them. So what does Abide have coming up in 2022?
All the things. No. We have very, very big, lofty goals and visions and dreams. So Cecily is a complete visionary. And so she dreams big. And so we eventually would like to open a birth center, right? Because here at this clinic, we don't provide birth services. We provide prenatal and postnatal support. And then most likely our clients either go to the hospital to deliver, or we refer them out to midwives in the area who can provide home and or birth center birth for the clients. But we eventually want our own birth center, right? Because that would be another game changer for clients to be able to have a safe place to deliver their babies, and be in an atmosphere where they're supported and their family can come into that. Because we know during this time of COVID, like that's changed a lot of the support that clients would be able to bring into the hospital with them. So we have many women who are out here birthing with only the support of the hospital staff, right? And that's not the village model of care. That's not safe for a lot of women, but they have to walk through it because it's the only choice that they have. And so a birth center is one of those things eventually. I can't say that it'll happen in 2022, but soon. Another thing is offering well woman care, right? Because we just offer the care during pregnancy. And another piece that we want to start offering is well woman care, because most women often only get support, only get medical care during pregnancy due to lack of insurance, due to lack of access, availability. And so we want to start offering those services for a discounted or reduced rate for our community so that women can start getting those annual exams. Because Black families or Black women are the leading cause of a lot of different cancers and, heart disease and things like that. And so if we can get people in to do those preventative screenings beforehand, then we can help to reduce those numbers as well. Also, a Spanish-speaking only clinic is something that we're kind of navigating. We have a provider now who's bilingual, who comes in and provides support to our families. And so we're going to start advertising those services to the community. Our material goods program right now is our program to the community, where we provide diapers, wipes, formula, things like that, free of charge to anyone who needs it. There's no income restrictions or anything for it. That program is predominantly Hispanic. And so we want to tap into that population to provide those services as well, because many of them may be undocumented, right? And so it's difficult to go and get insurance if you're undocumented, right? And so we actually did serve a Spanish-speaking woman who her husband was undocumented, and she was afraid to go and apply for Medicaid, even though herself was a citizen. She wasn't sure if they were going to investigate to the point where they were going to acknowledge that he was not and deport him. And so providing a safe place for people just to receive the support that they need without judgment and without fear of us reporting them, right? Just coming alongside them and meeting them where they are. So that's a couple of things that we have, in the work. It may not be 2022, but sometime within the near future. Yeah.
And I believe that's my last question. Thank you for meeting with me. Thank you for answering my questions. And thank you for all the work that you do for women in the area. So
thank you.
This is Brianna Pat with the Dallas Weekly, and that's all.